lockdown. So it's a quick, brief introduction to well-being and how physical activity can help support that. And I wanted to just start off by just showing you our Championing Active School solution. So you'll start to see this a lot more now as the comms comes out to schools. You may well have already seen it. It's on our website. And it's the solutions that help make the whole school an active school. And obviously the arrow there pointing to the child wellbeing offer, which is our new offer for the kind of latter part of this academic year and moving forward. And it was created during lockdown when we were all crazy working at home, trying to make sure that we were providing appropriate opportunities to make sure that our young people our young people's well-being was as efficient and effective as it can be, certainly the end of the second lockdown. So we're going to set the scene with some context around physical activity, mental health, and then we're going to share 3 solutions with you that schools can take the opportunity to access through the Active Schools, Champion Active Schools. So moving over to Charlotte, just do the context, that'd be great, thank you.
Okay, so this is the the latest statistics on mental health. It's 2017, but it is the most recent official data. And when you look at that, it shows that 1 in 8 5 to 19-year-olds had at least one mental disorder when assessed in 2017. And that 70% of children and young people have not had appropriate interventions at a sufficiently early age. And one stat that's really shocking to me is that 50% of mental health problems are established by the age of 14 and 75% by the age of 24. So we really need to see, well, what can we do about that? How can we help these young people? Next slide, please. So the slide before was showing you what was going on in 2017, but obviously we've had COVID since then, and that's had massive repercussions for all of us. And I know a lot of you in schools have noticed that some of your children have come back bigger. They're far more inactive. They may well just not be ready to learn. We know from talking to some families that children have gone to bed really late. They've been gaming. They've had their phones on in their bedrooms. So therefore the diet's gone out the window. There's just had no routine. And we know that a lot of children have been quite stressed and feeling anxious, especially about coming back. And we know that if actually their parents have been anxious, that feeds down into children themselves. So overall, there's been quite a big impact on children. And some of them will have suffered post-traumatic stress, especially if they've had members of their family who've suffered from COVID-19. So there's things that we need to start working on to improve their well-being. Next slide, please. So you probably all know most of this. The impact of physical activity is huge. We know studies show about how much it can improve sleep, improve self-confidence. If you've learned a new skill, that makes you feel really good about yourself, boosts your self-esteem. We know you get those feel-good hormones, it improves your mood. And if you're playing a game with other people, then it can reduce your social isolation, even if you're going for a walk. Improves your brain power. We've seen that before. We've talked about how much activity can actually increase your brain power. So really key for learning in the classroom. Obviously, it can improve our motivation, moderate our appetite. We're not so bored, we're not grabbing at food all the time. And what's key is that for those that may need medication, physical activity can reduce the need or the amount of medication that's taken. So really lots of good reasons why we need to keep these children active. Next slide, please. So in lockdown, members of our different teams got together to think about, well, what could we offer to improve child wellbeing? And we came up with 3 different training solutions, one for staff, one for pupil wellbeing, which Sarah will be telling you about, and one for parents. So the first one we're going to talk about is tree of wellbeing. So the tree of wellbeing focuses on all of the training workshops. You may have heard of the Wheel of Wellbeing, which is a Surrey County Council wide image, just to help people realise what the 6 or 5 different ways of wellbeing. You might see 5 ways, it's now become 6 different ways of wellbeing are mental wellbeing. And we've incorporated it into a tree here. So the tree is meant to be something easy for children to understand. And what we've done differently is we've added essential roots. And I'm sorry it's written so small on the diagram, but you'll see we've written it on the left in bigger font. So the roots are sleep, nutrition, movement, and water. And we tell children, and it's the same for adults, that these are key. These are key for being physically physically well. So those roots enable us to grow tall, to grow up, but those branches of well-being enable us to flourish. And those 6 branches of well-being are care, give, be active, connect, take notice, and learn. And we use this tree of well-being throughout the training workshops, and we explain more about what each of those branches are. So next slide. So starting with the staff training, this is designed for those staff that are working with children to support them emotionally. So not your traditional PE leads, and perhaps not your classroom teachers, but homeschool link workers, ELSA workers, child mental health nurses, any kind of support worker who isn't used to perhaps thinking about how important movement is in the work that they do with their children. The idea of the training workshop is to provide knowledge and skills to have those confident conversations with children about how they can increase their physical activity and actually the importance of doing that. We know that one staff member that attended said that she was working with a year 4 girl, for example, and she knew that she was on screens really late at night because she had them in her bedroom. And they, through this workshop, created a plan on how to reduce that and how to increase more activity. So we're helping staff identify ways to involve movement in their work. We pinpoint them to lots of different resources they can use, including things like Jumpstart Johnny and things like that, so things for activity bursts. We discuss other factors that affect well-being, so those roots again, so the importance of nutrition, sleep and hydration, because it could be that they could have a conversation with those children about, have you filled up your water bottle, how much have you drunk today, because actually that can really help you feel energized and learn. We also give some resources to take away so that staff can start to put things into practice. And we know that this has been really useful so far. So it's a virtual 1 hour, 30-minute workshop, costs £30 for a staff member who belongs to a member school and £40 for non-member school staff. And if you're interested, the email there is our workforce lead, Laura White. So if you want to jot that down, and email her and let her know if you're interested, or somebody in your school might be interested, and she'll take it from there. The next workshop we talked about, we organised between us, was a parent workshop. This is ideal for schools or organisations who want to engage with parents more and actually get them involved in taking a role in the physical and mental well-being of their own children. It's virtually run on Zoom. It's 75 minutes and very interactive. So we use polls and we use the chat box a lot. We try and get parents to engage with each other with some solutions, and we play videos. So it's not just being spoken to, it's involving them in the discussion. We talk about all those things that are connected to the tree of wellbeing. So physical activity, sleep, nutrition, hydration. We talk about portion sizes, the effect of sugar, how to reduce screen time, and as well as that, we talk about the 6 branches of mental well-being. And we found that parents have come away with a whole different set of pledges themselves. So everyone takes away something different. Some have said they didn't realise how much physical activity a child should have. Some said they didn't realise that they were giving too big portions to their children, and what the effect of all the carbohydrates were. And some of them said that they're really going to try and reduce screen time, though of course we acknowledge it's been really hard to do that during lockdown. So parents also get a resource to take away with kind of a synopsis of the slides, but also some signposts to other resources that they might need help. So we also pinpoint to parenting puzzle, which is a workshop if they needed some support on parenting, and things like the 5-a-day chart that they can use at home just to make sure that the children have 5 portions of fruit and veg. So lots of helpful resources and things like that they'll take away. The cost there is £200 for non-member schools, £160 for member schools. And if anybody's interested and want to know more, please do contact me. And that's the email there, charlotte.long@surreycc.gov.uk. Next, over to Sarah for the final workshop we have planned.
Thanks, Charlotte. Just a quick question on the parent workshop. It's £200, isn't it, for the school, so they can invite as many parents as they want to that session?
Yeah, it has to be the school or an organisation booking it. It's not for parents just to book on separately. We want the school to host it, and we'll then give the Zoom link for the school to send out to their own families. Yeah.
Thank you. Okay, and on to the final solution, which it's probably the most important cog in the wheel, as it were. And I think it's really important to recognise that actually the themes throughout all of the sessions that we deliver is the tree of well-being, and we really make that evident throughout everything that we do. So it resonates with a parent that might have come onto a parent workshop and a pupil that might be taking part in with a wellbeing warrior session. So they start to connect, and it kind of instigates conversation around kind of the tree of well-being and the roots and things like that. So it's important to understand that. So the wellbeing session is year 4 pupils only. When I was just listening to those slides that Charlotte just said around established mental health at 14, you almost think that year 4 is probably a little bit too late to be trying to share messages around kind of their whole well-being. But we made the conscious choice to direct this training just at year 4 pupils, and it really does try and connect mental health and well-being and how being physically active can positively influence their mind. It's a classroom-based activity currently. We launched it in January, and we wanted it to be accessible to in a classroom environment, as well as be as active as possible. So there are some restrictions. We're finding there are some restrictions around it, but yeah, we use lots of activities like your jumpstart Johnnies. We use games to things like rock, paper, scissors to talk about emotions and feelings, and we try and connect them and the flower to the young people and ask them to kind of make their changes. So a large section of the training is around understanding the whole well-being and physical activity, and we spend a bit of time just exploring an emotions and feelings around certain situations that being active can be. So we explore things like if you're not selected to be part of a school team, or if you're joining a new sports club, how do you feel? And a lot of these emotions are around negative feelings that they will display, and that's the type of training we want them to do. But we spend a lot of time trying to work with them around thinking of positive situations for not being in a team with your friends, around, you know, I'm not in the team with my friends, but I've made new friends, to trying to kind of change the way that they think about things. We also, that quote at the bottom there from one of our pilot schools is really interesting. We have a brain scan. I'm pretty sure that everybody's seen that. It's a brain scan of somebody sitting for 20 minutes and then somebody moving for 20 minutes. We spend a bit of time exploring how activity kind of invigorates the brain and makes them feel good, and all the types of different things, all the different kind of feelings that they get from being physically active. And again, we use lots of games for that. I think what's really, really important at the end is that we also ask pupils to kind of pledge to make their own change around one of the 4 roots. So we give them all a little leaf, and they write on the leaf one of the changes. So it could be drink more, it could be more active, or one of the 4 roots, and then they stick their leaf onto the kind of their own class wellbeing tree. So they end up then being left with a tree and a charter to say, you know, what a wellbeing warrior does. And that top left hand side or right hand side, whatever it is on your side, is a little sticker that they get at the end, and we encourage them then to just take responsibility for being a wellbeing warrior and tell people about the training, what they've learned, and all the different types of pledges that they're going to make to kind of improve their own overall well-being. So that's the 3 solutions. I'm going to stop sharing so I can see some of you, but